Okay, hello. This is the Community Health Assessment Project titled Opioid Crisis in the Hispanic Population in New Hanover County, North Carolina, for Nursing 408 by Christopher Moody, Jen Marie Pate, Kelsey Harvey, and Kelly McCrae. So our introduction here is to examine the specific population-based needs within New Hanover's young Hispanic community as it relates to the opioid crisis. And the Hispanic population was chosen by us because this population is the youngest that has an opioid addiction, and we wanted to basically see what the reasoning was and how we as nurses can help. Demographics: according to the 2010 census, there were 227,198 people living in New Hanover County. Racial makeup of the county: 81% whites, 14.2% black or African American, 0.6% Native American, and 5.4% of the population was Hispanic or Latino. According to the North Carolina Department of Health and Human Services, 2018, more than 12,000 residents of the state have died from opioid-related overdoses between the years of 1999 to 2016. That's a lot. So our windshield survey, this population density map here outlines the area. That little dot right inside of the circle, that's where the Hispanics live. And this windshield survey takes place inside of that red area. 30.2% of New Hanover's County Hispanic families call that area home. Housing in this area is composed mostly of single families, brick ranch homes. These homes are well maintained. Children's toys are visible when you drive by. Cars are noted in most of the driveways and under car shuttles. There are several bus stops in this area for public transportation, but there's no shelter or benches that's available in the area. So you will see a sign that says public transportation, but there's no security for the rain or storm. So the opioid epidemic here, its increased dependence has developed from decades of high prescription rates and dosages. The opioid epidemic is overwhelming. The state's medical providers, DHHS, witnessed a significant increase in emergency room visits across the states. So in 2016-2017, a 40% increase in opioid overdose occurred, doubling overdoses cases what was recorded in 2009. 68% of those overdoses involve heroin or other illicit opioids. White males comprise 62% of these cases. The CLAS standard, basically what this is the National Cultural and Linguistically Appropriate Services standards to provide safe, effective, quality care and services to various diverse populations. So these principles is to ensure services are responsive to the different cultural health beliefs and practices of our diverse communities. In New Hanover County, there are various communities which include populations of individuals from diverse cultural backgrounds. So some solutions to this epidemic is to utilize standard nursing processes, appropriate culture communication, specific education, and advanced healthcare technologies. We are capable of providing the young Hispanic population an opportunity to fight the current opioid epidemic. So for our community assessment and format interview, we used, for direct collection of the data, we used the key informat. An interview, face-to-face interview was conducted, and the findings preceded that many issues contributed to poor health. The health department nurse basically said a lot of issues that contributed to poor health was obesity, smoking, drinking, minority groups below the poverty line, and those without insurance. So those were the groups that needed the most care, according to her. So priorities to address the growing population and improve the health of residents: we should have additional affordable resources, additional funding for existing resources, increased personnel, including primary care providers, and we should have improved education in the community. So overall, health and quality of life in New Hanover was related as needing improvement with the emphasis on prevention of harm and disease. So for the secondary analysis, population summary, the 2010 census showed 202,667 people for New Hanover County, North Carolina. The median age was 37.3 years old. 81.6% of the population is white, 14.2% are black, 1.2% are Asian, 0.5% are African of American Indian or Alaska Native, 0.1% are Native Hawaiian or other Pacific Islanders, and 2.4% are some other race. 5.4% identified themselves as Hispanic or Latino. Secondary analysis is the housing summary. So in estimation, 105,579 housing units are in the area. The median housing value is $215,000. Median mortgage cost of these homes are $1,485. The median cost of rent is $928 for this area. So in 2016, 64.4% of the population were in the workforce. 5% of them was unemployed, 0.3% in the armed forces, 35.6% not in the labor force. The mean household income was $71,553. 12.4% of the population was without health insurance coverage, and 4.8% of the population was under 18 and was unemployed as well. Community diagnosis strengths. So strengths and weaknesses were identified from County Health Rankings at countyhealthrankings.org, the website. Higher than North Carolina average diabetes monitoring and mammogram screening. Only 4% of children are uninsured, and 15% of adults are uninsured. 90.6% of citizens had a high school diploma 2009 to 2013. So those are some of the strengths. Some of the community diagnosis weaknesses. New Hanover ranks 12 out of 100 for healthcare outcomes in North Carolina. They rank 13 out of 100 in length of life and 24 out of 100 in quality of life. 25% of the adult population is obese. 19% of adults report heavy drinking, and 10th percentile for alcohol impaired driving deaths. Nearly 2 times the number of drug overdose deaths compared to statistics for North Carolina. The top health issues identified for the New Hanover County by community members are obesity, excessive drinking and alcohol-related traffic incidents, unintentional poison and deaths from prescription drugs and opioids. The problem of opioid abuse and drug overdose is selected as the top health issue because its importance to the community, potential to save lives, and the fee is feasible with many low-cost costs, opportunities to improve the issue. Community diagnosis for New Hanover County is an ineffective health maintenance related to substance abuse as evidenced by a higher percentage of opioid overdoses in North Carolina. Risk to the community because of lack of education and services. At-risk diverse populations are at a greater risk, including the Hispanic population in New Hanover County. Persons affected, approximately 165 deaths per 100,000 populations due to drug poisoning. Despite many resources, limitations to community resources include financial burden of providing resources, lack of awareness and education, and the social stigma surrounding the addiction. Community resources for drug overdose and opioid abuse. Programs and resources that serve the North Hanover County are an asset to facing this top health problem and can be found at health.nchgov.com/opioids. So children, teen, and pregnancy services, emergency and women and children services are available at New Hanover Regional Medical Center. Also, Wilmington Health Access for Teens and Youth has a specific program to kind of help them with opioid abuse. as well as something added, some community resources for older adults now have caregiver services for the older adults and senior resources that has opioid problems as well. Also, there's free helplines available in English and in Spanish. The Trillium Healthcare Services for North Carolina, Trillium Mobile Crisis Team, and the SAMHSH National Healthline. Many more resources and treatment centers available to the community, which includes the North Carolina Harm Reduction Coalition, Mobile Needles Exchange Program, Wilmington Treatment Center, Launchpad Recovery Community, and the New Hanover Regional Medical Center Rehabilitation Hospital. Some primary interventions, primary prevention and interventions aim to prevent harm before it occurs. So some of these interventions to address drug overdose and opioid abuse is education about harm reduction, including needle exchange, sharps disposal, safe medication disposal, non-pharmacological pain resources, Narcan, access, and use to reduce mortality. So some secondary interventions to reduce the negative long-term impact of harm is through early detection and screening and to re-establish health. Secondary interventions to address drug overdose and opioid abuse is providing resources on treatment and recovery, including helplines, the inpatient and outpatient services. You can provide resources to pregnant women struggling with opioid or drug abuse. Some tertiary prevention and intervention aim to improve quality of life in patients with long-term, complex, or permanent issues. To address the drug overdose and opioid abuse, they can provide resources that address substitution and medication-assisted therapies, provide resources on treatment, recovery, and support, understanding that addiction is lifelong, there's nothing short-term about that, and to provide support to determine risk factors for relapse. Area amenities. There are restaurants, gas stations, and small stores within walking distance. Is a well-kept park with a children's playground nearby. Several families are seen being there. A new movie theater and shopping complex has opened a few miles away from this facility, town. The nearest hospital is located about 3 miles away, and there's a local pharmacy within short distance. But there are no medical facilities, clinics, or rehab centers noted in this neighborhood. So some population characteristics of New Hanover. Both Caucasian and Hispanic families are seen during the windshield survey. The majority of those seen were women with small children playing outside. No domestic animals noted, but a few of the beware of dog signs were visible. Business and industry at the end of the neighborhood, a packing plant associated with the port is seen. There are many stores, auto repair shops, warehouses, and towing companies nearby. The neighborhood is mostly homes with businesses located on the outskirts. So indications of ethnicity, all signs were in English. There were a few street signs suggested Hispanic origins, such as Chula Vista Drive. No churches were located in the area, but there were a few religious statues seen in the front yard. So for research, opioid addiction is one of the most common topics, as New Hanover County ranks number 1 in opioid-related deaths in the state of North Carolina. So to conclude this, despite this troubling statistic, residents of New Hanover County are stepping up to provide services to help battle this crippling addiction. These include rehabilitation centers, inpatient and outpatient, clean needle exchange locations, counseling for addiction disorders, local media professionals who have received special addiction training. So while New Hanover County has a long way to go to reduce the number of overdoses and deaths related to opioid use, there are promising steps being taken to combat this statistic. And our learning experience basically influenced practice on becoming culturally sensitive to the diverse populations, and now it helps us to become better nurses by understanding that there are addictions out there, but there are many resources and communities that can help change and make a difference in the youth. Our resources are located there, and thank you.